Hey, what's up guys? Today on our Table Talk segment, I would like to talk to you a little bit about bedwetting. That is because when we're looking at it, it's going to have a detrimental effect or a psychological effect on children because they're going to be very self-conscious and that might actually affect their self-confidence. Obviously, no parent wants that for their kid, but here are some of the mechanisms to why a kid might have bedwetting issues, okay? And we're looking at it, there are three different nerve plexuses or nerves in the nervous system that come out and control the ability for somebody to hold or to urinate. So when we're looking at that, we have some of the nerves that are coming in from the sacral nerves. That's right here in the pelvic nerve plexus. You also have the lumbar nerves, and then you also have the pudendal nerves. All three of these help control the bladder to different extents. So one of which the pelvic nerves help the ureters, which are from the kidney to the bladder itself. It kind of allows the muscles to relax, allows the urine to collect in the bladder. And then you have the bladder itself being controlled by the lumbar nerves as well. Whether it distends and tells you that you need to go to the bathroom, or whether or not that you have the muscles that are controlled by actually the lumbar nerve plexuses to actually hold that urine in. And it's an involuntary reflex, so it's not something that you control directly. That's all done by the autonomic nervous system, and that is not something that you actually control. There is two different sphincters, so there's an internal sphincter and then there's an external one. So on the internal sphincter, that's controlled by these lumbar nerves, and that's the one that just kind of happens automatically. That would be the one that you'd have the most problem with at night if you do not control that one. The ones when you're awake and you kind of maybe drink too much, you're on a road trip and you're kind of holding it, well, that's the pudendal nerves, and that's the one that you actually control. That's an external urethral sphincter. So the sphincter over here, we kind of look right over here. All right, so here is the bladder. We have the three different nerves. You got the ureters that's collecting from the kidneys that goes to the bladder. You also have the bladder itself being controlled by the lumbar sympathetic nerves. That controls the internal sphincter for the urethra, which is right in here. And then you also have the external sphincter right here, which is voluntary, being controlled by the pudendal nerve. So this is a little bit of a diagram of how that works out. But that is why we are able to do what we do, and unfortunately why kids, if they fall, and they do fall a whole lot on their rear ends, they might actually end up injuring some of these nerves in the sacral plexus and in the lower lumbar area, and therefore might actually be prone to bedwetting for these reasons. So adjustments in the sacral area and in the lumbar area can be very gentle, very effective, and allow that kid, be able to control and be able to have that self-confidence. So, you know what, for health and wellness, keep following us. We are going to continue to give you health tips, information. Our Table Talk series is meant to help inform and just enlighten. If there's any other questions, comments, or any other ideas that you'd like us to go over, please hit us up on the comments